most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
You're the most famous physical therapist on the internet.
In our opinion, of course,
Today,
Bob.
we're going to talk about 25 reasons to use a massage gun. And plus, we're going to discuss which attachments you may want to use when you do the reason. Let's get right into it, Brad. We got 25 to go. So let's, number one, we're going to actually read these off our clipboards here.
Our memory's not good enough to go 25.
Yeah, number one, we're going to, if you just want to relieve stress, it's a great thing for relieving stress. You're going to use, what I like is the air-filled one. That's better probably to show on that one.
It's soft. It's got some air in it. That's why it's called the air-filled one.
You can use the large round one too if you're using it on large muscle groups. It'll work, or even the small round one.
You'll know when you start working with it. Number two, relieve post-operative pain. You know, as long as the surgeon says after the surgery you're able to do this. So don't get aggressive or don't go after this unless you get permission.
Because we don't want you to loosen a blood clot and send it up to your home.
Exactly.
So, but the air-filled one works for that, right, Brad?
Yeah, but you'd probably use a softer one.
Again. Number three, reduce anxiety. You know, if you can calm your body down and convince it it's not in the fight or flight. Again, the air-filled. We promise we won't just say air-filled, but right now the air-filled one is a good for anxiety.
Thing, if you're tight in the neck or in the temples of the head, you stay away.
Right.
You do not massage the neck or up or the head.
Yeah, it's just too bony.
Manage low back pain. You've got tight muscles in your back. You would need to loosen those up. This can be a great way to do it. Oftentimes on the back, you're going to need a little assistance from someone else.
Yeah.
It's hard to reach back there.
And the thing about with the attachment, you can use just about any attachment on the back, but you have to figure out which one you can tolerate.
Don't get too aggressive.
Yeah. All right. Number five, help fibromyalgia pain. So any massage you have for fibromyalgia should be painless. You don't want to increase the pain.
Right.
This should be comfortable. So this is probably the air-filled one again, too, Brad. The air-filled attachment.
Right. You don't want to make it worse. You want to soothe it and calm it. Next one, muscle strain or pulled muscle. And this is one where, you know, if you got a pulled hamstring, you're going to start out when it's tender, maybe with the air-filled, but after it gets better and you can get in deeper into that muscle, which you do want to do on a strain, then you may go to one of the plastic ones, or even possibly if you're really athletic, you may get deep with the bullet one, we call it there.
Yeah, and the same next one, muscle recovery. Again, the small muscles, you may want to use the less aggressive heads like the air-filled or the round.
Yep.
But if you're larger muscles, you might get one of the knobby ones.
Sure.
And
like that.
Yeah.
Yeah. So the muscle recovery is talking about after you get done with a workout, your muscles are sore. You need to get some fresh blood in there and get the old stuff out. And the massage is going to help that.
And it might even be, 4 hours later. You're trying to get some blood flow to it.
Exactly.
So
muscles warmed up and stretched prior to the event or the sport. So in other words, before you do your activity or the event, you can do some massaging, particularly on areas that may be problematic as far as history of strains and that kind of a thing.
Yep. Number 9, reduce muscle tension. This, again, we're talking about a relaxing massage now. We're not talking when that's going to, hurt so good. You want to, you can probably use the air-filled or the big round one. And just, it's going to be, you want it to feel good. You're trying to relax.
Right. So don't get aggressive with the pressure. And you can adjust these guns. There's 5 speeds on a lot of them.
Most of them variable speeds. And we recommend start on the lowest speed, and you can always work your way up, but don't flip it up to 5 and jump into it right away unless you know what you're doing.
Next one, to enhance exercise performance. This is kind of a repeat of the one I just mentioned, but again, you're going to get the blood flow, get the fresh blood in there, keep the muscle loose and supple. There's a lot of high-level athletes that use this kind of approach.
Yes, they do. Number 11, relieve tension headaches. No, I would not recommend using a massage gun for relieving tension headaches. That's something you can use your own hands.
Yes.
But do not use a massage gun.
Sleep better. So again, nothing from the neck up, but if you have some tight muscles or tension in certain areas, massage them, and it's a good way to initiate that sleep.
People have said that about me, Brad. There's nothing from the neck up going on. So, if you want to reduce the pain of osteoarthritis, so if you have a painful knee joint or painful elbow joint, what we're going to recommend is you're going to work upstream and downstream. In other words, you're going to work the muscles below the knee and above the knee, but that attached to the knee.
Yeah.
Because you're not going to massage right on the joint.
Right. Yeah, but you don't massage the bone. Next one, decrease stress in cancer patient. Now, again, this is something you're going to do under guidance of the physician. You just don't grab one and go. You have to say, would this be a good idea? Because there could be
chemo or whatever.
So caution light on that one.
But it should be, again, painless. This is, you're trying to reduce stress. You're not trying to increase stress.
Should feel good right away.
Yeah. Decreased rheumatoid arthritis pain. It's the same thing as osteoarthritis pain. You're not going to massage over the joint, especially with the rheumatoid arthritis, where there may be some laxity from it. So you're going to massage the muscles above it and below it, and that should affect the joint in a positive manner.
So laxity, the joint is loose.
Yeah.
Maybe hyper or double jointed, hypermobility, that kind of a thing. Trigger points or knots. Now that is where we can. If you have there's a common trigger point on everyone right back in here. If you're going right directly to this, I would probably start. I might even start with this one and work up to this one. But it's going to hurt at first, but then it should feel good after 20 to 30 seconds and feel it release. That's what we're looking for, is to get that knot to release and become soft.
All right, next one. We just had some experience with this, Brad. Scar tissue. My wife had a procedure on her legs for getting rid of some of the veins, and they told her she should do some massage over the scar tissue.
Yeah.
My God, did this work great.
Did it?
She was shocked. Like, there's big, bulgy scars.
Really?
There was, and she took them right down.
And it flatten
them out and supple but she did a little bit of what you recommended, where you take the round head and you go sideways. Show it, Brad.
There we go. We got it going. Let's say we're going, so let's get it so you can see on the skin. So we're going not straight into it, but sideways over that scar tissue. Not so aggressive, but it's doing what it's supposed to do. We want to break it up in an appropriate manner. Nice work.
This next one, Brad, I'm sorry, number 18, I'm jumping on yours.
Oh, that's all right.
We already did relaxing massage. I don't know why it's mentioned twice.
Yep.
Number 19, tendonitis.
Oh, sure.
We were just doing that.
Yep. So, there's the muscle belly, and tendons oftentimes can be really short. So it may be like the tendon from your quadriceps to your knee, and we talked about this one in another video, where you get in there on that tendon, or the tendon between the patella and the tendon, or the tibia.
Yep. There we go. Number 21, help chronic neck pain. Again, we would not recommend using the massager on the neck or the head.
Nope. Stay away.
Number 22, that's yours, Brad.
Lower joint replacement pain. Now, this is something, so we're talking about a total knee, total hip.
Right.
Actually, I have a patient right now. He's going to get a total hip, and he's using the massage gun around those muscles to keep them loose until the surgery. But after surgery, you're going to talk to the surgeon and find out what's appropriate and what he allows.
Yeah, either way, you're not going to go over the joint.
No.
Once the knee is replaced, you'll do muscles above it and below it again, just to help it along. Number 23, if you want to increase your range of motion, it's going to help if you loosen up and make the muscles around the joint more supple. You can use pretty much any attachment based upon your comfort level.
Right.
I mean, if you're really aggressive, you can use one of the more aggressive heads. And if you're not, you can use one of the air-filled ones even.
And we have a video specifically on which head to use.
For which problem.
Right.
So.
Yep, and the last two kind of fit together, Bob.
Well, no, not 24. Migraine frequency?
Well, I guess they fit together, and they're saying we don't use a gun.
Right.
Yeah. So migraine headaches, again, you're not going to do headaches, nothing on the head.
Well, I would say next one you can do, Brad, improve quality of life in hospice care.
Right. I guess as long as you're on board, the doctor's on board with you.
Yep. Because again, the massage should be painless. It would be probably the air-filled would be a
Right.
good one. So
It may be depend on how the cancer is being treated.
Right.
Other things that may influence it.
all right, this video is a part of a series of videos on massage. So if you want to see the entire series where we go over different body parts
Sure.
and how to massage them, go to bobandbrad.com, go to the program section, and in there you're going to find different programs like on sciatica, and we're just putting one up on hip pain.
Sure.
We got one on TENS, plantar fasciitis.
Yep. You could see a list of them.
So look at the massage one, pick out the videos you want to watch, and they're all about 10 minutes long.
Right.
And along with them, Brad?
This is, for this particular video, it's a really advantage. We have a PDF printout.
Yeah.
You could print this out and look at the reasons or whatever that we
Right.
go over. Then you don't have to listen to us babble for 10 minutes.
There you go.
Shorten it up.
And, we're going to charge you a lot of money for this.
Yeah, it's all free, everything, not even an email.
Yep. Check it out. Thanks for watching.